said, I would like to now turn things over to Central Region President Gary Havokin to welcome everyone. Gary.
Brian, thank you so much, and thank you everybody for coming this evening. It's a different time, as Brian suggested, and we really wanted to have an opportunity to see each other's faces to the best of our ability. So we have sequestered ourselves in our offices. We've removed our masks, and we're here so you can, at least see our faces, because we're not able to see yours this evening. But I do want to thank everybody for attending. First, I'd like to thank New Britain Mayor Aaron Stewart for being with us this evening, the Meriden Mayor Kevin Scarpati, any other town official that is joining us on our meeting tonight, our annual meeting. I'd like to recognize our Central Region board members, as well as our board member emeriti. And I'd also like to thank and introduce Mr. Jeff Flax, our president and CEO, who will be speaking in a little bit. So it's really my pleasure to be here tonight. I think you're going to hear a lot of activity that's been going on for the last year or so, and we're very happy to present that to you this evening. So what I will start off with is introducing our board chair, Jason Howie, to provide a welcome. So Jason, please.
Thank you, Gary. Good afternoon. Thank you to all our guests who are joining us virtually today for the annual meeting of the Corporators for the Hospital of Central Connecticut and MidState Medical Center. I'm Jason Howie, Chairman of the Central Region Board of Directors, and on behalf of the board, I would like to call this meeting to order. I'm pleased to welcome our Corporators, leadership, physicians, and staff who have joined us this afternoon, and I would also like to thank and welcome Jeff Flax, President and CEO of Hartford Healthcare. We're all here today meeting virtually because our world is a little bit different than the last time we were all together. We are still in the middle of a pandemic, and the second wave is upon us. Over the last 8 months, I think we've all gained a new appreciation for the hospitals in our communities and the invaluable services that they provide. The frontline workers at the Hospital of Central Connecticut and MidState Medical Center define what it means to be a hero. To stare right in the face of the unknown and still do what is necessary to care for people and save lives. That is what this year has been all about. And through it all, we saw kindness from so many of the communities that these hospitals serve. Think about driving down the road and seeing signs of "A hero lives here" and the big red hearts of people saying thank you because they know the risks that those people have put themselves at. I think being part of this meeting feels different for all of us, and in a good way, because we've never been more proud of this organization than now. And I know whatever the coming weeks and months bring, we're in the most capable hands thanks to countless professionals. Coming up, you're going to see how the Central Region answered the call when COVID-19 arrived and how they've managed to get back on track. But also, the incredible growth that's taken place even in the middle of the pandemic. We also played offense. Before we hear more about the wonderful work and care taking place in the Central Region, I would like to thank and acknowledge our outgoing members of the board, Denise McNair, Dr. Irfan Chugtai, and Dr. Lenny Ashudo, who remains as president of the Hospital of Central Connecticut's medical staff, and Dr. Howard Bowie, the outgoing president of MidState's medical staff. And I would also like to welcome Dr. Aziz Benbrahim as incoming president of MidState's medical staff. I would also like to recognize our newest board members, Bruce Eldridge, Vince Fortunato, Dr. Cynthia Hall-McCraven, and Stephen Savasic. I would be remiss if I did not point out the unwavering commitment, talent, and skill of the hospital leadership, the board, medical staff, and most especially its employees who tirelessly care for our loved ones and our communities and our healthcare heroes. And finally, I would like to recognize all of you as ambassadors from our community for your dedication and partnership and for your support of the continued success of our hospitals. At this time, I am pleased to recognize our new corporators. Both the Hospital of Central Connecticut and MidState Medical Center corporators are selected in order to achieve broad representation and support from all segments of the communities that we serve. Serving in an honorary capacity, Corporators have a sincere interest in the improvement of healthcare delivery, play an important role in advocating our hospital roles and mission in the community, and provide a perspective of the needs of our hospitals. I would like to present our 6 new Corporators. Maria Campos Harlow, Executive Director of the United Way of Meriden and Wallingford. Yvette Highsmith Francis, Vice President, New Britain Community Health Center. Jason Duranko, Southington Branch Executive Director, Southington Cheshire Community YMCAs. Shane Lockwood, Director of Health, Plainville Southington Regional Health District. Mark Pooler, Chief Executive Officer, Southington Cheshire Community YMCAs. And Liz White, Publisher and Executive Vice President, RJ Media Group. As we are meeting virtually today, a request was sent prior to this meeting to cast a motion in acceptance of our 6 new Corporators. I would like to thank those who casted their vote. The election of these new Corporators has been approved. Thank you all for agreeing to serve as Corporators. Your commitment to this organization is instrumental in supporting a healthy community. I would now like to introduce Jeff Flax, President and Chief Executive Officer of Hartford Healthcare.
Good evening. Thank you, Jason. Thank you, Gary. And let me just express my gratitude to everyone who is joining us this evening for this meeting. We certainly never imagined a year ago when we were together that we'd be meeting like this under these circumstances. This pandemic, it's unprecedented. We plan for natural disasters. We routinely plan for events that could occur and terrorist type events and nuclear and chemical and biological events. And we even plan for pandemic type events, but never something of this magnitude. And it's really, it's been an opportunity to see in many ways, has been described by Jason and others as seeing the very best within our institutions or within our communities. When a pandemic of this magnitude hits, in many ways you have to throw the book out. There is no very clear way to describe and respond in real time to the order of magnitude of an event like this that went across the world. And in every instance, we don't have the luxury of time to make the very best decisions. We need to make decisions quickly. We need to make them with the best information that's available to us. And then we need to constantly be reviewing them as we get more and better information and adjust accordingly. And I've been incredibly proud of the agility that our team has shown, particularly tonight. We're celebrating the Central Region and the connection and the work that was done with our communities across the Central Region and the demonstration of the values of Hartford Healthcare, of integrity, caring, excellence, and safety, really guiding our efforts. Jason mentioned it in terms of the healthcare heroes that work within our organizations. I mean, this was to see the members of our team at all levels of the organization rise to the occasion. When so many people, importantly, were doing the right thing and retreating to their homes in the spring and quarantining under lockdowns. People who work within Hartford Healthcare, specifically within our hospitals and so many levels within our organization, were running into the crisis where there was such ambiguity and so many unknowns. And that's the calling of working within healthcare. That's the sense of duty. That's the sense of service. And I'm enormously grateful for the skills and contributions, discretionary efforts, just the commitment of so many countless people who work within our organization. And I'm also enormously grateful to our community. I've often said, one of the things that makes living in Connecticut so wonderful is the sense of tradition and community and the honor that people have in terms of supporting and serving one another from a citizenship perspective. And it was so apparent in this crisis, the number of people who volunteered, companies who changed their manufacturing processes to make products for us around personal protective equipment, people who donated service, time, effort, manpower, money, goods to help us when we were in our greatest needs. The outpouring of community sentiment and support was really beyond measure. and was absolutely critical, important to us, and many times when those moments mattered most. We now find ourselves in that second surge. We run, I think, as everyone is well aware, we have a very advanced modeling system that we built with MIT. And we're now looking at into the middle of December with a steady incline in terms of numbers of positive cases within our communities, number of patients that we anticipate to be admitted to our hospitals. And our organization has to be ready to take care of people under all circumstances. Today, we have 160 patients across all of our Hartford healthcare facilities. At the height of our pandemic in the mid to late spring, we had about 560 or so. So we're still about 400 some odd patients shy of the height of our peak activity level from an admitted patient standpoint. But if you look where we were in August, there was a point in time we went for several days where we had 8 patients admitted, to our facilities. So there's clearly been a consistent incline. From a testing perspective, we're doing about 25,000 tests a week now across Hartford Healthcare. We have 9 permanent drive-through centers set up across the state of Connecticut. We have 5 mobile centers that we dispatch every day to different communities to partner with different community organizations. And across those 14 centers, our positivity rates range today from one community in southern Connecticut being at a high of 11%, and we have a community in Litchfield County today as low as 3%. So each community gets impacted differently for a variety of different circumstances, but we monitor the demographics very closely because we have a centers set up in every county in Connecticut, well distributed, and we're able to really pinpoint based on our testing data real time where there's greater risk, how we can use our contact tracing capabilities to stop the spread of this virus, to help protect the safety and security of our communities. We've done 450,000 tests to date, and we're ramping up our testing capability. We just expanded and doubled our testing capability in the city of Hartford, where we now moved it to the convention center. We moved our testing facility in eastern Connecticut to Dodd Stadium. We have other testing facilities that are going to be relocated in the central region, announced very shortly. So we're continuing to recognize the absolutely essential nature to contain this virus of testing and contact tracing. We celebrated at a homeless shelter just in the last week, where we've now completed over 1,000 mobile testing centers. And what that means is we go to churches, we go to community centers, we go to youth centers, we go to prisons, we go to all different types of community-based facilities, from healthcare to social service agencies. And we bring testing to the community free of charge to our populations within our communities who are most vulnerable. And this has really been about health equity. There's been so many lessons learned within this pandemic, not the least of which something that was known but never underscored at the level it is today, there's tremendous variation. There's tremendous need where we can see really disparities within health equity within the communities we serve, where there's a lack of access to different services. There's food insecurities. There's not prevention and wellness services in place, and there's not primary care type services. And the end result really has been a disproportionate number of people within our communities, people of color, who have been more vulnerable during this crisis with COVID-19. And I'm very proud of what we've been able to do more than 1,000 times now of channeling the resources within Hartford Healthcare. We've built a stockpile around personal protective equipment. In fact, we have one of our warehouses in New Britain that we built for Hartford Healthcare, where we've had to build new warehouses because we've acquired tremendous amounts of personal protective equipment. We spent $30 million this year, approximately, up to this point in time, whereas last year, for the same point in time, we spent just less than $4 million. So we're buying personal protective equipment at unprecedented levels. We've had to build several new warehouses to store it. we've done over 400,000 virtual visits through telephonically and through video. So we've seen tremendous innovation throughout this process. And I've spoken so often and written so frequently across our region. Everyone has been talking throughout this pandemic, or when can we return to normal? When are we going to return to normal? And I can assure you in healthcare, we have no interest in returning to normal. We're going to be better than normal. We're going to be substantially better than normal. We're going to be much more focused, and we're going to start to eliminate many of the absolutely wrong things that are occurring from a health equity standpoint. We're going to use the technologies we've created to connect to our patients with far greater access. We're going to leverage the safety procedures we've put in place around infection control, which are going to far better protect all the patients who we're serving. We're going to leverage the modeling and the predictive analytics so we can assign our resources, our people, our equipment, our technology with greater productivity, greater efficiency. And we're going to be providing care everywhere. You're going to see this weekend, this is a preliminary of a promotion that we're going to be bringing to the community. And it's 1-888-860-COVID. And this number, 1-888-860-COVID, is where we are now combining all of our services that we've built and put in place under one organized structure to make it even more accessible for our communities. So any point in time during the day, from morning, noon to the wee hours of the evening, any person in our community who needs to speak to a behavioral health specialist can call 1-888-860-COVID, and we're going to put them into contact with a behavioral health person over the phone. And if they need emergent and urgent care, we'll facilitate that. If a person who in our community needs drive-through testing, we're going to register them for drive-through testing. If a person needs any type of consultation and wants to speak to a healthcare professional about the symptoms they're experiencing, if they need guidance on what level of care and treatment, we're going to have a healthcare professional available to speak to people 24 hours a day, and we'll facilitate making those appointments through our access center. So we've built new services like HHC Campus Cares, which is now providing medical directorship and oversight to the majority of our colleges and universities across Connecticut. We've built Hartford Healthcare at Work, where we're providing medical directorship and advising small, medium, and large-sized companies trying to support the economic vitality of the region. And at the end of the day, we're trying to use our ingenuity to do whatever we can to help the community heal, be safe, be secure, and able to succeed, through this pandemic. So we have to recognize that we're not by any means through this process. We have an entire team dedicated to vaccine distribution. We're building our capabilities, which has a lot of complexity on how to do that safely and appropriately. And I'm confident Hartford Healthcare will be in a leadership role across the state distributing the vaccine. We're working hard to expand our capabilities today around testing because the needs are beyond anything we've experienced to date. And we just have to continue to each day respond and try to anticipate the issues at hand. But right now, the importance is that we continue to practice safe social distancing, that each person wears a mask, that we practice good hand hygiene, that we pay close attention to our travel restrictions, and that we stay closely informed. And when people have need, concern to get tested, to follow the procedures post being tested relative to quarantine and contact tracing, and to leverage all the services that we've put in place to try to safely protect people within this community. So, again, I'm so proud of everyone who works within Hartford Healthcare during this time period. We have more than 30,000 people who are doing everything they can individually and collectively to be here in this moment. This is a historic moment within the world, within our country, and within our local communities. And our organization's built for this. In many ways, it's our purpose to provide these types of services to our community when there's greatest need. And we are going to continue to do whatever we can to rise to that occasion. I'm very grateful for Gary Havokin and his team and their leadership. This team has put enormous discretionary effort forward. And our hospitals within the central region, our medical offices, our home care services, our surgery centers, endoscopy centers, all of our capabilities, our behavioral health centers, all are trying to adjust to unprecedented circumstances and ensure that we're able to support whatever needs can be imagined during times like this. And I think our central leadership team has really done everything within their power to try to protect the safety and health and well-being of our people, the people who work within our system and respond and care for our patients, and unquestionably for our patients and our families. So again, thank you for your support, your continued engagement within our system, particularly within the central region. And I am enormously hopeful next year we're going to be in person. We're going to be able to have a meeting where we can have different types of discussions than we're forced to do so this year. And we'll be continuing to talk about the learnings through this pandemic and how we are going to emerge, as I frequently describe, better than normal. I'm absolutely certain of that. So, Jason, thank you for the opportunity to join you this evening and for your board leadership and all of the members of our board in the Central Region for standing behind us and supporting us throughout this crisis.
Great. Thank you, Jeff. I appreciate your comments and your vision and direction. And it's, we're ready to go. I mean, we're coming out of the COVID 1, going into COVID 2.0, which we'll talk about a little bit more. But I think it's a great opportunity this evening to really share some of the insights as far as the regional progress that we've been making since the beginning. So I'll ask Tina to put up the presentation. If we could start on slide 5, please. Excellent. Thank you. So if we were in the same room with each other, I'd ask each one of our members of our leadership team to stand up. So maybe they can stand up in their own office and be recognized. But I really, this team has just done an amazing job over the last year and beyond. We do have some new faces to our team that I'd like to introduce as well. So first, I'd like to introduce Jeanette Edwards, our Vice President of Operations, Sean Curtin, Vice President of Finance, Karen Fasano, who's our Vice President of Patient Care Services, Dr. Jeff Finkelstein, who's our Vice President of Medical Affairs, Tina Akowitz is our Director of Human Resources, Dr. Fadi Hamami is our Chief Medical Information Officer and the go-to guy for most things for us. Stephanie Armelin is the Director of Planning and Business Development. Stephanie's new to our team this year. We welcome her. Dr. Drew Metzger is the Medical Director of MidState Medical Center. Cheryl Rogers, who is our Regional Director of Human-Centered Care. Todd Osowski, who's our H3W Lean Sensei. And new to our team is Dr. Aziz Bembrahim, who is now the President of the medical staff at MidState Medical Center, and Dr. Lenny Laterio Asciuto, who is the President of HLCC Medical Staff. So I just can't thank this team enough for just doing an incredible job working with each other day in and day out and making a difference every day for our patients. So thank you all for your hard work. We'll go to the next slide, please. So I wanted to just start off with a snapshot of what our market area looks like in the central region. And you can see within the gray is our primary service area. So that's really what we focus on when we look at our, the depth and breadth of our services that we provide to the citizens in the central region. Many of the zip codes of patients that come to our facilities come from those areas. And the circles you'll see are our strategic footprint. Basically, it's what we talk about for a growth opportunity as we develop our future strategy for the central region. Obviously, in healthcare, we need to continue to grow. And so we look to these new areas for growth. And just briefly, in the northwest corner, we're looking at the way the services are provided and things that we can add. So we're starting to add new subspecialty providers in that Bristol, Burlington area, Waterbury area. We have an office now, HHCMG office in Prospect. And we're looking to, what our opportunities are further into that area. And then in our North Haven, North Branford, kind of the southern tier, we have a new alignment with a group called PACT, Physicians Alliance of Connecticut. And they provide primary care and subspecialty care that we are starting to align with. So we do now have a North Haven office, which houses one of our neurosurgeons, actually two now, and has about 60,000 square feet to grow into. So we're very excited about the future opportunities as we move into the future, thinking about our strategic growth template. Next slide. So I wanted to start off with really a snapshot of what this fiscal year looked like. So coming into fiscal year 20, we couldn't have been more excited. Frankly, looking into the first just 5 months of the fiscal year, we were coming off a very successful year, fiscal year 19. Going into this next year, there were many initiatives, recruitments, new programs and services that were developed, new territories that we started, that really started to bear fruit. So you can see the blue lines is a measurement of our activity, and the red line is actually the budget. So we measure ourselves against our budgetary activity. And the green line is what we did the year before. So within 12 months prior, that's where we marched out. So we were really encouraged about our activity for fiscal year 20. And then obviously, come the beginning of the year, we started to look at this pandemic, which started in Wuhan province in China, and we really started to look at it with a cautious eye. We didn't anticipate what the impact was of this, but we knew that it was going to play some role in our future provision of healthcare services. Next slide, please. Some of the defining moments of 2020 actually are, when we started to look at our surge capacity plan. And Jeff Flex mentioned it, and I mentioned this in many conversations. We've been planning as healthcare organizations. We plan all the time for disasters, and we're really good at the mass casualty disaster one-shot deal, where there's an environmental disaster, a hurricane, or a tornado, God forbid, or some type of other type of disaster, where there be a flood or an explosion. We practice these things quite often. But even though we may have thought that we planned a little bit from pandemic when we were going through SARS and MERS and the other type of biological diseases that are out there, we never anticipated, we couldn't anticipate what COVID-19 was, what a global pandemic is, and the impact that it had on our operations. So as January, February, and March wore on, we saw this virus, spread across the world. And then on March 18th, it hit us in the region. So when it started to hit us, and even a little bit before, we started to take unprecedented measures to stay ahead of the virus. We put together our regional incident command team. We communicated with the system incident command team. We started to think about how we are going to stay ahead of this. And we came up with a plan of having 6 beds available at a time. Now, as this was evolving, we realized that the preponderance of patient presentations were that of older and sick patients. And so we knew that our intensive care capabilities were really essential to manage this. So we put in place 24/7 incident command. We developed what's called a regional operations center, or ROC. And ROC's primary purpose is to help us with the redeployment of staff, with the scheduling of different things, really kind of that hub of activity that everybody can call into in the region to find out what's needed and what's going on. We had screening stations that were new. We had visitor restrictions that were new. We stopped all elective procedures, which for many of you who know that's the lifeblood of our organization. Obviously, it's very disruptive to stop that for the patient, but also for the organization from a business perspective. It was a difficult decision, but we had to do it in the best interest of our patients. We looked at our space and really re-examined the type of space that we had, and took opportunities to develop plans to expand into those spaces and develop ICUs where ICUs weren't before. And so we did a lot of planning on that. Our surge capacity plan that we had in place was rendered useless. We had to create a whole new surge capacity plan, basically on each campus of our 4 buildings, 4 main campuses that we have in the central region. And so we maxed out on paper the opportunity to add beds to each one of our campuses. And so the good thing is, coming out of this or going into the next phase, which hopefully, knock on wood, is a little softer, we have very comprehensive plans in place. We have a good infrastructure for incident command, and we're really working to hone our communication skills, not only amongst ourselves, but also amongst the system as well. Next slide, please. So as I talk about recovery and rebuilding, we went through the pandemic. We saw our peak. We dipped over the summer, but really communications really stayed where it needed to be. And I just want to recognize the leaders of our communities. They were just amazing. And we have Shane Lockwood on the call tonight. We have Mayor Stewart. We have Mayor Scarpati. Just 3 people that I can call out. And I don't know if you can see it. I don't know if you can see me speaking, but I have 2 things in front of me. This is a piece of paper. This is a prop here, but this is a piece of paper that I pulled out on March 23rd, and it was the beginning of our phone calls to the chief elected officials and the heads of the municipalities in which we serve. So there's 10 municipalities on here, and then each time we talk to each other, I had a standard agenda, and then I would tick off when those individual leaders were on there, and you can see the ticks. These folks were on this call all the time. It was rare that any of the leaders in municipalities missed a call, and it was great to communicate kind of openly around what was going on from the hospital perspective and also hearing about what was happening in the community. We also had meetings with the board of directors just to keep them up to speed, so I had the same type of thing. We went from weekly to twice weekly, then eventually daily, just because we wanted to make sure the communication was ripe, and our leaders were just incredible throughout that. The other prop that I have here is, this is called March 29th, our ICU staff, and I carry this with me as well. So there was a lot of concern and a lot of turmoil at the beginning of COVID as people were trying to figure it out, and what COVID-19 did from a transmission perspective, how to protect yourselves, how to protect your frontline workers. And the agenda items on this list here from March 29th, number 1 was communication. Okay, that's pretty consistent. Number 2 were nurse staff ratios. Number 3 was deployed nurses or redeployment of nurses to the front line, maybe from the community, maybe from a different area like medical group, a different department that typically are not ICU level nurses. Techs, charting, how do we chart these types of patients? Travelers, do we pay crisis pay for travelers? Mass casualty incidents, and looking at other hospitals for benchmarking. So this is what we talked about at the very beginning of the pandemic, which really drove kind of our focus area throughout as we responded to this. But as quickly as we got into it and responded to it, we actually even more quickly planned ourselves out of it. So we were kind of in the middle of responding to the disaster when we started to think about, boy, we have to reopen. There's a lot of patients who need to get elective surgery, elective procedures done, who have been sitting at bay not getting them done. There's a lot of people in the communities that have, signs and symptoms of something wrong clinically that have to get seen. And they have no trust that they're going to be safe within the environment of the healthcare system. So, this kind of goes into my recognition. Mayor Stewart and Mayor Scarpati both volunteered to go on Facebook Live and go into our emergency departments They interviewed our emergency department physician director in a mask in the emergency department alone. And they did so to assure the community that we were safe and that don't not come in because you're afraid of getting COVID. You're not. It's a safe environment to be in. As a matter of fact, when Mayor Stewart came into the HLCC emergency department to interview the medical director, Dr. Dave Bono, she was 8 months pregnant. So, it was incredible, the trust that she put into our facility, our physicians, our system. And that really did rebuild some confidence within our emergency department. So I want to thank everybody for everything that they've done to help us kind of get ourselves back up and running again. And we'll next slide, we'll talk a little bit more about what that looks like. So, where are we now? What's happening in kind of we can't really call it the post-COVID world because we were never without COVID, but, what are we doing to kind of make sure that we have certain parameters in place to reduce the risk of transmission and to keep our employees, our frontline, our patients, our family members, because we now have lifted, our visitor restrictions. What are we doing to keep that in place? So we are screening every patient and visitor that come in. For our elective procedures, we have a quick turnaround COVID test to make sure those patients are negative prior to getting their procedure done. We have colleague screening and testing. So we screen our colleagues as often as we can. We try to do as much testing as possible, and that's beyond just the hospital employees. It's also into the community. We have a drive-up testing center at MidState, which was one of the first in the system, which was just incredible. Our team built a model around how to do a drive-up swabbing station. Nobody knew how to do that. They created how to do that. As a matter of fact, one of our nurse practitioners, Kelly Toth, who was recognized later, she did such a good job, she ended up getting promoted. And, and that's how we do this. We take advantage of those who want to, as Jeff said, run towards the incident. And there were so many people, there's so many heroic stories of what happened throughout this pandemic. But the drive-to testing now has become quite popular. And now the problem is we have too many people. So we're trying to figure out how to streamline that process and have the wait time shorter. We see 450 or so patients a day at the MidState drive-through station. So we're going to be figuring that out over time. Next slide, please. So just an acknowledgement of our community partners. That was our focus throughout this, is really maintaining good communication with everybody, providing awareness around healthy living, physical activity. We created and distributed semi-weekly e-blast to a range of organizations, including chambers of commerce, faith communities, health departments, districts, provider networks, United Way. These e-blasts included information on preventative measures with focus on social distancing, hand washing, and mask wearing. The more that we got the word out, the better we'd be from a safety perspective. So we wanted to be that beacon of communication to the communities in which we serve, and we continue to be. These are just some of the agencies that have been just amazing to work with and have helped us out to deliver the messages around safety. Next slide, please. So I just want to spend a moment on access and growth. And, clearly we have to go back to growing, as I said earlier, our organization and our footprint. We've done an amazing job over the last couple of years, and COVID was a little bit of a hiccup. But, now we're back at it. We're really looking at opportunities for us to grow. And the one thing I'd like to announce today, and many people might have seen this in the paper, but last week we signed a purchase agreement with Hunter's Ambulance Service. And Donna Hunter is on the phone. She's one of our corporators, as is her sister Dana. After 57 years of owning a company, a family-owned company that started back in 1963, it took a while, but they decided to talk to us and find a partner. And after almost 2 years of talking, we got through what we needed to get through, and we signed the agreement last week. So we're extremely proud that the Hunters family and the organization chose us to be their partner and to acquire their organization. I think we have like cultures, and we think the same. They've done an amazing job over the years, and we're very proud to be affiliated and to now be acquiring that ambulance service. So that's an exciting piece, and they're primarily based in the central region. So we will have, we'll have that within our region, and it will also be used throughout the system. But very proud of that as well. I mentioned PACT earlier. PACT-MD, as we'll see, is it's going to be a very tight alignment with a series of physicians that are already in place in that kind of that southern tier, that North Haven, Hampden, Upper New Haven area, and very excited about that opportunity. And then we also have pre-admission testing. So one model that we've developed around kind of pre-testing is to develop a pre-admission testing program so that the patients don't have to go to their individual primary cares. They can go to our pre-admission testing program, which actually enhances the safety of those patients in that preoperative phase. So it's a very exciting endeavor. Next slide, please. And, just specific to some of our physician growth, I'm sorry, I skipped over that slide there. Thank you. We've seen some great physicians come on board. This is just an example of 4 of our docs that we recruited over the last year. Dr. Sonny Mangilla is a neurosurgeon. He's in the HLCC space. He's also going to be down in North Haven seeing patients. He's quite the character. And I encourage anybody that wants to meet Dr. Mangilla to do so. He calls himself Sundog. That's his rapper name. So he's quite the interesting guy. Dr. Amanda Ramos is a new GYN oncologist. Wonderful addition to our team, as is Dr. Stephanie Saucier, who is a cardiologist, and really will be an added value specifically to our women's health initiative around cardiology and other diseases. And Dr. John Griffith, who is a urologist from the Tallwood Urology program for Harvard Healthcare. So we're very excited to see these folks start. We also have new recruits in pulmonology and hospital medicine and emergency medicine and primary care in our communities, all within fiscal year 20. Next slide, please. So we have the in Hospital Central Connecticut, just a couple of items just to announce to you. So this past year, we started a new program. It's called the Auris Health Monarch Platform. It's basically a endobronchial ultrasound. So it's a program that allows via an Xbox type of controller access from the physician into the lungs to take a look at what's going on inside it. It builds a three-dimensional model of the patient's own lung anatomy, and it helps diagnose and eventually treat any type of lung tumor or lung nodule that needs to be taken care of. We're the first in the system, the second in the state to get this, and the program's been fantastic right out of the gate. So we're very proud of that program. We also developed with vascular and wound care a new limb preservation program. It offers multidisciplinary, individualized treatments to help prevent an amputation for someone who may suffer from certain health issues such as diabetes. It's also a preventative clinic, only hospital in the system to have the limb preservation program. As many of you may have read also, we have an initiative right now that's bringing us to become a trauma level designated, level 3 designated hospital. And so in September, we started our trauma level designation journey, which means that we're beginning to accept trauma patients in the Hospital of Central Connecticut. We have a trauma team that's been designed and trained to respond to these incidences. And as of now, actually from September 1st to now, November 12th, I think we've seen close to 300 patients that came in traumatic situations. So it's typically about 2 or 3 trauma patients a day. And our team has just done an amazing job with the trauma journey. So, really the whole intent is to make sure that we've got the programs and services to treat the members in our community right here at Hospital Central Connecticut without having to send them to other hospitals. So next slide, please. MidState Medical Center, and I know I mentioned this last year during our annual meeting, we were on a multi-year journey to right-size the operating room. So we spent a lot of money over the last several years, but we increased the operating rooms from 11 to 15 and actually added a new OR, which is a hybrid OR for vascular, cardiovascular, and interventional radiology procedures. But these ORs that we added are significant sized ORs for any type of procedure, mostly, for the orthopedic type of procedures that need a lot of equipment. And that's just it's incredible to see that. We also added another building and opened that up. So we have locker rooms, we have space for storage, we have a break room for our physicians and for our OR staff, and it's been really extremely well received. So very happy and proud to have both of the hybrid lab and the new operating rooms at MidState. We're also expanding 2 rooms to make those larger as well, and that's actively going on right now. And then finally, MidState, our medical oncology and infusion services are now under the direction of Hospital of Central Connecticut. We did that as a business decision. The services won't change, but it helps bring the hospital under the umbrella of the Cancer Institute. So it aligns and standardizes the care that we're providing to our patients and how we do business and how we align ourselves that way. So next slide. Sorry for the delay. Obviously, access and growth around philanthropy. Just because we had a pandemic didn't mean we stopped talking to people about helping us develop programs and support and subsidize many of these programs that are pretty significantly costly. But our community is just amazing. And honestly, everybody who's on this call tonight and everybody who we communicate with have been so supportive over the years. As nonprofit entities, we really do rely on charitable donations to help meet the program and capital needs. During the past year, thousands of charitable donations were received by the Central Region. Just within the COVID confines, we're receiving donations all the time. And that was not only, financial donations, but food and personal protective equipment, et cetera. Our donors play a vital role in our mission, and we're deeply grateful for the continued financial commitment and ambassadorship to our community. We're especially grateful to our communities and many businesses and individuals who demonstrated such an outpouring of support for all of our frontline workers. So thank you to everybody who helped us and supported us over the last year. It's very, very well appreciated. Next slide, please. And also just, as we evolve through the year, certain people are identified as really leaders in their space, not only from an administrative perspective, but also a clinical perspective. So just a couple of things, on this slide, top left, there's 9 Nightingale Award winners for excellence in nursing. We had a great little luncheon for them, and they're just amazing people. Each one of them are recognized. The stories behind them were incredible, really, truly angels among us. Our Connecticut Orthopedic Institute at MidState won the National Orthopedic Nursing Excellence Award. The American Record Journal recognized MidState as its Reader's Choice Award, best for Best Hospital and Best Emergency Department. Also, Quinnipiac Chamber of Commerce gave MidState its Shining Star Award for the doctors, nurses, and professionals who helped care for patients during our pandemic. Nurse practitioner Kelly Toth, which I mentioned earlier, who was initially in charge of our swabbing stations. She was also named a healthcare hero by the Harvard Business Journal for her role in setting up those swabbing stations. So Kelly, what a wonderful job you've done, and actually did lead to a promotional opportunity for Kelly. So very strong up-and-comer within our leadership role in our system. Hospital Central Connecticut was named Best Hospital by the Britain Herald for the Best of 2020 poll. And finally, the American Heart Association recognized both HLCC and MidState with a Gold Plus Award for our ability to reverse the effects of a heart attack or stroke. I also remember that the town of Southington came up with a Healthcare Heroes Award, and for the first time, the inaugural award went to Bradley Hospital for all of its hard work during a pandemic and all of its commitment to the community of Southington. So I wanted to add that as well. Next slide. So just some facts and figures really quickly. You could see the first 5 months, which I mentioned earlier, and how we were doing so well. And in March, we started to take a dip as COVID presented. April obviously was the significant hit. And you could see over April, May, June, a little bit of July, those were our primary COVID months. And August and September, we started to build ourselves back out of that. And so that's kind of a snapshot of the majority of the country. When you look at everybody's P&L, everybody's measurement of activity, you see a substantial dip around that April, May, June timeframe, and then back, swing back up. And now we're really facing, that swing back up of what I call organic cases, so cases that you would expect within the confines of your facility. And then we're also seeing a little bit of a swing towards an increase in COVID cases, too. So we have both. The difference is we're prepared, we're ready, and we're managing. We've been managing COVID cases since March. There's been maybe 1 or 2 days that we had 0 in any of our hospitals. So we've had these cases along. Now there's an influx of cases of COVID, but we're managing that, as well as the census of non-COVID patients. So I'm very proud of our team for doing that. But that's our transition. So that means patients who were here and then were discharged from our facilities or transitioned from our facilities. The next slide is MidState. So just another snapshot of that activity there. But we're getting back up there. And actually what we don't have here is October, which is the beginning of fiscal year 21. And our October, this past October was one of our more successful months ever. So, we've rebounded. We're seeing business come back. We're seeing the confidence of, the folks in the community come back into our emergency departments, the elective surgeries. We have a lot of, safeguards in place. And so we're really, we're excited for what the future holds for us. We're also excited to get a vaccine so we don't have to see COVID patients anymore. Moving on a little bit into our Leapfrog, next slide. Our Leapfrog scores, as you know, it's a measure of quality and safety within our system, within our hospitals, respectively. And over the last couple of years, we really took a hard look at our Leapfrog scores, and we made some significant inroads. So, last year we were identified as an A for MidState, which is the highest honor, and HLCC went from a C to a B. And I can tell you that the difference between where we are, we're in a B plus range, basically. We're about 0.2 percentage points off from an A, and I anticipate the next go-around, which happens about every 6 to 8 months, we'll have 2 A's pretty quickly. Next slide. We'll skip and go right into the next slide with the data points. Thank you. So, and the reason why we're going to go into an A is because the performance of the Central Region has just been incredible from a prevent harm perspective. We have a goal to do no harm to patients. And that's not what we're in this for. We're in this to help people. And, the stigma of there's 100,000 deaths per year in the United States healthcare system from hospital error, we want to avoid that. We don't want to be in that stigma or that statistic any longer. So, over the last several years, along with the system, we've been on this journey to really reduce harm significantly in what we do. And so we've absolutely seen some awesome progress in that space. So our system goal is an 11% system reduction in patient harm events for last year. Our teams were created, dyad teams were created to focus on specific topics like pressure ulcers, falls, et cetera. And each region received an anticipated target number to contribute to the overall goal. So Central Region target was 86, we had 83, so we're below that. HLC target was 53, we had 53, and our MidState target was 33, and we had 30. So not only did the Central Region do better than target, the system had a 23% reduction overall in our harm rates. Next slide, please. Which is just fantastic. The Central Region, based on our annual targets, the first time we really started tracking our fiscal year versus our calendar year, we saw a significant reduction in our rates. So despite the pandemic, we had significant reductions. HLCC 57.5% reduction, MidState 47.8% reduction. Compared to last year, we're well below our target numbers. So really, really proud of the team. You can see the efforts here. You can see, the direction that we're going in. Next slide, please. And as many of you know, we monitor and track our serious safety event rates. And you could see, the graphic tells it all. We've had really a sustainable reduction in our serious safety events. We monitor this very, very closely. If, God forbid, one happens, we're all over it. The entire, team not only gets on it and does a root cause analysis, but learns from, the opportunity. So we are all over serious safety events, and we continue to meet on a regular basis. I actually chair a meeting every Monday with all of our healthcare leaders throughout the region, and we look at any event related to patient harm or mistakes that are made or even behaviors. We talk about it all. And so, what we do is we have the folks who are in the front lines come on and tell us happened. What was the decision? Why did they make that error? How did they adjust? How did they improve from it? And the question that I always ask is, how can we help you move forward? And so not to make that error, and how can we make sure that other people don't make the same error? So we've had a very transparent, open dialogue around that for quite some time, and it's really moving the needle specifically. So, all in all, and we'll get into the rest of the day here, because I really wanted some dialogue with you guys as well. But all in all, very, very proud of our region, very proud of being part of the system. This was a very tumultuous year. It was a year of unexpectedness. It was a year of change and, quick action. We had to really work together, and I quite often say this, many people came into this as colleagues, and now they're like family. We had over 200 people redeployed in the Central Region from their job that they were typically in to another job because of the pandemic. I've heard so many wonderful stories of people just now respecting others in their workplace, because now they have understanding of what their challenges are. And it's just, so there's a lot of positive that came out of this and continues to come out of this. There's a lot of learnings. So, and Jeff mentioned it earlier in his comments that, we're going to come out of this stronger. There's no going back to where we were. It's only going forward, and we're going to be a stronger organization. We've learned a lot about the delivery of healthcare and how to work through things. And I couldn't be more proud. We're in a great, great spot. And I'm really strongly looking forward to the future. It's nothing but bright from my perspective. So I want to thank you, and thank you for listening. And I'm going to turn this back to Brian to moderate our questions and answer session. So Brian, please.
Gary, thank you. And thank you for that look at everything we've been doing for the last year. It's incredible that even in the midst of a pandemic, we've been able to grow and really just expand in so many ways. So that was certainly nice to see. As Gary just mentioned, we want to open it now to our question and answer session. We do have a few questions that were submitted ahead of time. But again, if you do want to ask any questions, there's the white taskbar there on the side of your screen on the left-hand side. You can put a question in there, write a message, and then just hit enter, and I will be monitoring that. So first question is going to go to Jeanette Edwards, our Vice President of Operations in the Central Region. With COVID cases rising, do you plan on going back to visitor restrictions like you did earlier this year? We had restrictions in place when it got bad. We loosened them. People want to know if it's going to go back to what it was in the spring. So Jeanette, any insight on that?
Sure. Thanks, Brian. So, while we are currently allowing visitors, I do want to point out that today we do have some restrictions in place. For example, we only allow one visitor per patient. We do have some limited hours, and we do ensure proper screening and masking for all of our visitors upon arrival. And we really believe that visitors and family members are vital to our team developing care plans, and we know that they provide a multitude of benefits to our patients while they're in our care. And so we want to try to preserve that. We are constantly evaluating the situation, however, to ensure safety for all. I mean, that's clearly our utmost priority. At this point, we have no immediate plans to further restrict visitors. Again, I think we're constantly evaluating, but at this point, no decision has been made to further restrict visitors.
All right, Jeanette, thank you. Next question is going to go to Dr. Jeff Finkelstein, our Vice President of Medical Affairs. If COVID-19 continues to get bad, will you have to cancel all elective surgeries and procedures again? So something we did obviously months ago when COVID got really bad in the springtime. Jeff, could that possibly happen again? I mean, a lot of people out there with stuff scheduled, and we don't know what's going to happen here.
Right. So that's a great question. And I like to think of elective procedures as medically necessary procedures. And my first answer is I hope not. But certainly our goal is to take care of everyone to the best of our ability. So if you're asking for what do I think is going to happen, we may have to, I hope not that we have to cancel. But if we do, I don't think it's going to be an all or none. I think it's going to be, how do we redistribute them so that we can take care of patients to the best of our ability? Do we space out surgeries that might require a short ICU stay so that we have more capacity? So rather than doing 5 on one day, maybe we'll only do 2 on one day, 2 the next day, 2 the next day. So I think we have some creative scheduling we can do before we'd have to cancel medically necessary or postpone. I hope that makes sense, but my answer is I hope we don't have to, and I think there's some steps we can do to create capacity before we would just postpone medically necessary surgeries.
All right. And Jeff, while I have you, the other question, and a lot of people want to know about this one, when can we expect a vaccine to be available, and how do we know if it will be effective or even if it's going to be safe?
I've been answering this question for months, and even 4 or 5 months ago, I predicted November or December. I even narrowed it down to the 1 or 2 companies. So I'm going to go out on a limb, and I think we are going to get emergency authorization in the next 3 to 4 weeks. And I think it's going to be a phased rollout. There's certainly challenges to overcome with the cold storage and distribution. So I think what you're going to find is that there's not one vaccine, that there's multiple vaccines over the next few months, and that you'll start seeing the first healthcare workers get vaccinated probably in December or January. I don't think it's going to be one vaccine fits all. I think there's going to be some vaccines that are better in older adults, some that are better in younger adults, some that are going to be 2 injections 3 weeks apart, others are going to be 1 injection. So I think for the general public, you're going to start seeing it late first quarter in calendar year 2021. I think healthcare workers, we're going to see it in December, and I think we're not going to release anything before it's safe. And the studies on effectiveness are very promising.
All right. Very good. Thank you for that perspective. Next, I want to go to Karen Fasano, our Vice President of Patient Care Services. I have 2 questions here. Karen, the first one, how are we keeping people safe who are coming into our emergency departments? Hospitals across the country saw a big dip in volume. People were afraid to come in, and they were staying home having heart attacks, strokes, because they didn't want to go to the ED. So what measures are in place, and really kind of use this as an opportunity to remind people that it is safe to come to the ED if you do have a medical emergency?
Sure. Great question, and thank you for asking it. We are continuing to screen every individual that walks into our hospitals. And so there's a series of questions that they're asked, and they are asked to mask, and we do take their temperature upon arrival. Every staff member wears a mask and a face shield or goggles entering into every patient room. And patients are asked to remain with a mask on if tolerated. If they're not able to tolerate it, we ensure that our staff wear an N95, which is a special mask, as long as with their face shield. So we continue to use social distancing in our waiting rooms. We are continuing to utilize frequent hand washing. And we are using our PPE to ensure the safety of our staff as well as the safety of patients coming in for treatment. So I feel that the emergency departments are very safe. I actually feel safer at work than I do in the local grocery store because we are aware of their surroundings and we've put many safety measures into place to ensure the safety for all of our patients as well as our staff. We do restrict visitation for individuals who are known COVID positive or PUIs, which is person under interest. And those are the individuals that are being tested for COVID. We are trying to assure the safety of their family members until we provide a diagnosis. So we are restricting visitors for those diagnoses for those type of patients. We do make certain circumstances deserve different interventions for families to visit, and each one of those cases are taken under consideration at that certain time. But once again, I do feel the emergency departments are very safe.
All right. Yes. Good message to get across to everyone. The other question, Karen, how long will the drive-up testing at MidState last? You know, it's been really invaluable to the community. I know today, yesterday, there were nearly 400 cars that went through there. So is this part of a long-term plan because the community has really benefited from it?
So another great question, and I'm smiling because we have no intention of stopping or reducing the swabbing drive-through tent. We actually started about 6 to 7 months ago, seeing only about 100 patients a day. One day we hit 200 patients, and we were really shocked at the amount of volume. We're actually seeing between 450 and 500 patients in a day. We are evaluating if we will be moving to a different location that can accommodate the increased volume. We do recognize that our volumes have increased tremendously, so have the wait times. We are strategizing to ensure we can get the community through in a very timely manner. But we have no intention of decreasing. Actually, just today we're having conversations. Do we need to extend the hours to allow more individuals to be tested? So more to come on that, but there is no intention of decreasing or stopping the drive-through swabbing.
All right. Good news there, Karen. Thank you. And finally, I want to go back to Gary, this question you'd be able to answer. What has the pandemic taught you and really everyone, the entire administration, in terms of how to obviously, care for patients, but to also really kind of strengthen that commitment to the community and our relationship?
Yeah, Brian, it's a good question. I think that the first thing is what it really showed me is the power of relatives, the power of visitors. Having time where there were no visitors in our hospital was very disruptive for not only the patients who really needed their loved ones next to them, but also for our clinical teams. And, I've been hearing a lot about, other hospital systems canceling visitation policies because COVID rates went up. It's honestly the last thing we want to do. Now, obviously, patient safety is first, but, the visitors play such an integral role in the care and treatment of those individuals. It's incredible. And I don't think we've ever had that clarity around that, and we do have strict policies that only allow one visitor at a time. But it's just amazing the power of how, having a loved one next to a patient really helps them in their treatment journey. I think the other piece, the other kind of learning moment that I've had are, we have an amazing bunch of people, in this region, and that's obviously where I am. But, it was incredible to watch the people run towards the areas of opportunity, the areas of focus, and run towards the front line, basically. There were those that retreated, absolutely, but the majority ran towards the front line. And all I kept hearing was, how can I help? What can I do? I'll do whatever you need me to. And that's amazing. That speaks volumes for, the folks that work in our region, work throughout our system, and also our communities, because I still hear that from the communities. What can I do? How can I help? And I love that. So, I couldn't be happier with the situation that we're in right now. We're going to manage through this. There will be a vaccine. We will we'll get on the other side of this. At the end of the day, we're going to be much, much better for it. So, I really just, incredible day tonight. I thought the questions were awesome, and very happy we were able to have this year, even though it's virtual.
Exactly. Gary, thank you. And thank everyone on the leadership team, obviously, who answered the questions. Greatly appreciated for those who were on the call and the presentation. With that said, Gary, I'm going to hand it back over to you with closing remarks.
Yeah, so thank you, Brian. So that basically, I just said it, and really happy with everything that's going on. Also very proud of our board members and our medical staff. Our board members have been, always available, asking, if there's anything they can do, helping to facilitate, and one story I love to tell was just the phone call that Sean Curtin, our CFO, and I got towards the beginning of the pandemic from Jason Howie asking what we needed from him. And he said, what do you think about if we build a prototype on a face shield? And we said, great. We were looking for PPE because, we had this pandemic to manage. And Jason's company, who many of you know, OK Industries, typically makes devices for medical equipment. And they have engineers and assembly lines, et cetera. And so Jason said, well, I think we're going to develop this prototype, and we're going to build these things for you guys. And so Sean and I said, fantastic. So Sean and I started talking about how to fund it, what to do, getting the resources, et cetera. Within 24 hours, Jason called back and said, you guys don't worry about anything. I talked to the superintendent of schools. We could use all the schools in New Britain for assembly line. We went to the community foundation and a couple different foundations to get funding. They're going to pay for all this. We've got volunteers that want to help throughout the community, and it was done. And they made, I think it was 22,000 masks. It was unbelievable. Just a small snapshot of the amazing efforts of our community. And that came from our board chair, but there's so many other people that did that for us. So I just can't thank everybody enough. And I'd love to turn this to Jason to close the meeting tonight. So Jason, thank you. And it's now on you. I know he's been having a little bit of a connection issue, so
yeah, it looks like we may have Jason. Jason, are you there?
Yes, can you hear me?
We can hear you. Great. It's all yours. Close us out.
Okay. I'd just like to thank everybody for attending the annual meeting, despite not being face-to-face in a more familiar environment. But with no further business, the meeting is now adjourned. Have a good evening.
Your call will be disconnected.